Well, it is the other new vaccine some Americans will need this fall. In addition to an annual flu shot and the new COVID booster, there's now a vaccine available to protect older adults against RSV. But a new poll finds many people who could benefit from the shot haven't heard about it yet.
In older adults, we're not talking about a simple cold. We're talking about potentially pneumonia, hospitalizations, and even death. And there's a vaccine that can protect against those complications.
A University of Michigan poll finds the majority of older adults want to reduce those risks. Of those over age 60, nearly 2/3 were interested in getting vaccinated against RSV. However, only 52% said they had heard of the new RSV vaccine before they took the survey. But lead researcher Dr. Preethi Malani says the interest is encouraging.
Even among people who were not aware of this vaccine, there was substantial interest in getting vaccinated. All of this underscores the need to get information to people and make sure people know how to protect themselves against severe RSV.
A report from the American Medical Association finds in adults over age 60, RSV causes up to 160,000 hospitalizations a year and up to 10,000 deaths.
We're asking older adults not just to get their annual influenza vaccine, but to also get a COVID booster and to consider getting an RSV vaccine. These are safe and highly effective vaccines. If there are questions, make sure that you are getting good information. Talk to your healthcare provider, talk to your pharmacist. No one wants to be hospitalized. No one wants to get sick from pneumonia. And in the past, we didn't have the ability to really prevent RSV. So this is a really big breakthrough.
And the CDC says while those 60 and older can get the RSV vaccine on the same day as other vaccines, common side effects such as fever and soreness may be increased if you do. Some studies also suggest your immune response may be stronger if you get the RSV vaccine separately.